Hyperosmolar Hyperglycemic Nonketotic State, HHNK, also known as Hyperosmolar Hyperglycemic State, HHS, typically presents with neurological symptoms such as confusion, seizures, or even signs suggestive of stroke. Diagnosis often begins with a point-of-care glucose reading, which is usually markedly elevated. Serum labs will often greater than 800 milligrams per deciliter. Unlike DKA, there are no ketones and no significant acidosis. Patients with HHNK are often severely dehydrated, so begin with aggressive fluid resuscitation. Also start insulin therapy and electrolyte correction. Close monitoring is needed, so ICU admission.